What do hypertension, type 2 diabetes, and depression have in common? The answer might surprise you. These three diseases, though vastly different, share a crucial commonality. They are largely preventable and manageable through a healthy lifestyle. Now let's delve into the world of hypertension first. It's a condition that silently affects millions worldwide. Known as the silent killer, it's a disease that often goes undetected until it's too late. Hypertension is primarily caused by an unhealthy diet, lack of physical activity, and stress. Common symptoms include headaches, shortness of breath, and nosebleeds. But the good news? It's controllable. Regular exercise, a balanced diet, and stress management can do wonders in keeping hypertension at bay. Remember, prevention is better than cure. Moving on to the second disease on the list, type 2 diabetes. This chronic condition affects the way your body metabolizes sugar. Risk factors include obesity, poor diet, and lack of exercise. Here's the kicker though, just like hypertension, type 2 diabetes can be prevented. A diet rich in fruits, vegetables, and whole grains, coupled with regular physical activity, can significantly reduce the risk of developing this disease. And for those who already have it, these same lifestyle changes can help manage the condition effectively. Finally, let's switch gears and talk about a disease that affects the mind, depression. It's a serious mental health disorder characterized by persistent feelings of sadness, loss of interest, and a lack of motivation. Warning signs can range from changes in sleep patterns and appetite to feelings of worthlessness and thoughts of self-harm. It's important to remember that depression is not a sign of weakness, and it's not something that one can simply snap out of. Professional help is often needed, but a healthy lifestyle, including regular exercise and a balanced diet, can play a supportive role in managing depression. So, what's the takeaway from all this? Hypertension, type 2 diabetes, and depression, while different in nature, share a common thread. They are preventable and manageable through a healthy lifestyle. It's important to remember that our health is in our hands. Small changes in our daily habits can make a big difference in our overall health. Don't underestimate the power of a balanced diet, regular exercise, and stress management. They are your weapons in the fight against these common diseases. Remember, it's about quality of life. It's about making choices today that will benefit you tomorrow. So, take that first step towards a healthier you. Your body and mind will thank you.
Have you ever wondered why heart health seems to be a topic of constant conversation? Or why arthritis, a condition often associated with aging, is increasingly affecting individuals of all ages? Today, we delve deep into the intricacies of these two prevalent health conditions, cardiovascular disease and arthritis. First, let's turn our attention to cardiovascular disease, a leading cause of death worldwide. This term encompasses a range of heart and blood vessel disorders, including coronary artery disease, heart failure, and arrhythmias. But what makes one susceptible to developing such a condition? Various risk factors come into play, some of which include an unhealthy diet, lack of exercise, excessive alcohol consumption, and smoking. Indulging in a diet high in saturated fats, trans fats, and cholesterol can lead to the buildup of plaques in your arteries, a condition known as atherosclerosis. This buildup narrows the arteries, making it harder for blood to flow through. If a blood clot forms, it can block the blood flow, causing a heart attack or stroke. On the other hand, a sedentary lifestyle characterized by little to no physical activity can contribute to obesity, a significant risk factor for heart disease. Furthermore, excessive alcohol consumption and smoking can raise your blood pressure, over time leading to heart disease. But fear not, for there are preventive measures within our grasp. Engaging in regular physical activity, maintaining a healthy weight, and eating a diet rich in fruits, vegetables, whole grains, and lean proteins can significantly reduce your risk. Steering clear of smoking and limiting alcohol intake can also go a long way in keeping your heart healthy. Switching gears, let's delve into the world of arthritis. This term refers to around 200 rheumatic diseases and conditions that affect joints, the tissues that surround the joint, and other connective tissue. The most common types include osteoarthritis and rheumatoid arthritis. Osteoarthritis, the wear and tear type, tends to occur as we age or following an injury. It begins in the cartilage and results in the bones rubbing together. This leads to symptoms such as pain, stiffness, and swelling. Rheumatoid arthritis, on the other hand, is an autoimmune disorder that primarily attacks the lining of the joints. Over time, it can result in bone erosion and joint deformity. This type of arthritis often results in warm, swollen, and stiff joints, particularly in the hands and feet. Managing arthritis pain is crucial for maintaining quality of life. This can involve medication, physical therapy, and in some cases, surgery. However, there are also adaptive exercises that can help. These include range of motion exercises for flexibility, strengthening exercises to preserve muscle, and aerobic exercises for overall fitness. In conclusion, while cardiovascular disease and arthritis are prevalent health issues, understanding their risk factors, symptoms, and management strategies is the first step towards prevention and treatment. Remember, a healthy diet and regular exercise not only keep your heart happy, but also your joints. So make the choice today to prioritize your health. After all, it is the best investment one can make.